medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Last week we discussed how in the mouth we can find lots of inflammatory markers that suggest there's periodontal and even disease internally. So let's talk about the things that we can do to help or prevent periodontal disease, which is basically involved in all organs of the body. Of course, no sugar, brushing and flossing. I don't need to tell you that. But here's some ideas clinically that I use that are very helpful. One is swishing with nanoparticularized silver for 4 or 5 minutes and then expectorating that. Oil pulling, you've heard about that, using oil, bringing it in and out of your teeth for a good 15 minutes and expectorate the oil would be helpful as well. Resveratrol, actually resveratrol inhibits 2 of the main bacteria that cause periodontal disease. So that would be important as well. We know vitamin C because the collagen helps the gum line and anchors the tooth, plus vitamin C is anti-inflammatory. Along with that, vitamin A is also helpful. Low vitamin A levels can predispose an individual to a periodontal disease. And zinc, which is also equally important in the healing process, most of us know that. But did you know there are mouthwashes with zinc that you can get? I happen to like a mouthwash called chlorine dioxide, and if you put some zinc in that as well, it makes a formidable opponent against all of these bacteria and things that infect that gum, and affect the bone tissue underneath, which eventually will, of course, because of the change in the microbiome, lend itself to having some systemic problem. Like when you breathe in, it can go into your lung, or swallowing it into your stomach, etc. Also, be very cautious with using lots of mouthwash, particularly, of course, the alcohol-derived ones we've talked about before, but just as a reminder today, they can kill the facultative anaerobes that are in the crypts of the tongue, which actually help to extract the nitric oxide or the nitrates, and that which will become nitric oxide, how important that is to the circulatory system. Vitamin E and selenium are 2 nutrients also that seem to deter periodontal disease as well by keeping down the free radicals. And of course, coenzyme Q10, by the way, has also been noticed as a very good enzyme. Now, for the most part, you're giving most of these things to patients. Part of the thing that we should be doing is looking in the mouth when we do our physical examination as integrative, natural, cellular, physiologic types of practitioners. Look around that mouth. Look carefully at the gum line. Look to see if there's any bleeding, and ask the patient if there's any difficulty with this. Increase the CoQ10 significantly, as the Japanese have done in their research to help this periodontal disease, at least to 200 milligrams a day levels. Flavonoids, as well as good as they are and healthy for the body in general, they are also for the mouth too. And one that you probably haven't thought about very much, and I haven't either, but it reminds me every time I think of it, every day I drink something with honey in it. Raw honey is a fantastic probiotic, as we know, but it's also very, very effective anti-inflammatory particular material. So honey's a classic. Use it regularly, and that will help you as well. The combination approach of what you eat and the mechanical things of flossing and dental care and going to the dentist and having deep cleanings and things of that nature. But what we can do is we can look around that mouth, see if we see anything, recommend that person to a dentist or periodontist, and in the same time, use the things that we just talked about. It's extremely effective. And regardless of what the disease, entity, or problem that the patient came to you with, the mouth should be part of the whole body and should be identified, examined, and treated accordingly. I'm Dr. Mitch Ghen. Thank you so much for watching. If you have any further questions or information that you need, go to Dr. Mitch Ghen. That's DrMitchGhen.com. And as always, thank you for watching.